Hello everyone, I welcome you all to this channel and to this 19th episode of Target Nursing Officer Exams video. Question number 1. For a healthy man of 70 kg weight, the ICF or the intracellular fluid is option A 14 liter, option B 28 liter, option C 3.5 liter, option D 10.5 liter. Here the total body water comprises of 60% of lean body weight in men and 50% of lean body weight in women. And this total body water is divided into three parts, where two part is intracellular and one part is extracellular. Total body water is divided into 2/3 is intracellular fluids, 1/3 is extracellular fluids. And this extracellular fluid is further divided into intravascular, which is 1/4 part of extracellular fluids, and the interstitial 3/4 of this extracellular fluids. So now the question here, it says the healthy man of 70 kg weight. So the total body water for a man is 60% of the body weight. So 60% of is equal to 60 by 100 multiplied by 70. This 0 will get cancelled. This 0 will get cancelled. So 6 multiplied by 7, we get 42 liter. So the total body water of this man of 70 kg is 42 liter. Now we have to find the intracellular fluids. So the intracellular fluids is 2/3 of total body water. So 2/3, 2 divided by 3 multiplied by 42, total body water is 42 liter. So if 3 with 42, we will get, if we divide, we will get 14. So 14, now 2 multiplied by 14, we will get 28 liter. So the intracellular fluids is 28 liters. So the correct option here, option B, that is 28 liter. Question number 2. A healthy man of 70 kg, the intravascular fluid compartment is option A 14 liter, option B 28 liter, option C 3.5 liter, option D 10.5 liter. Here first we have to find the total body water. 60% of 70, we will get 42 liter. So now we have to calculate the extracellular fluids. The extracellular fluid is 1/3 of total body water. So 1/3 multiplied by 42. Here 3, and this one will get 14. 42 divided by 3, we will get 14. So it's the extracellular fluid is 14 liter. Now the intravascular fluid is 1/4 of extracellular fluids. So it's equal 1/4 multiplied by 14. We will get, if we multiply this by 14, we will get 3.5 liter. 3.5 liter. So the correct answer here, option C, that is 3.5 liter. I'll show you how we'll calculate. 4 here will go with 3, will get 12, and 2 remaining, and we'll put a dot here, will get 0, so 5 will be 20. So this is the answer. 3.5 liter is the intravascular fluid compartment. And in the same way, the question they might also ask about the interstitial compartment. So the interstitial compartment is 3/4 of extracellular fluids, 3 3 foot multiply extracellular fluid is 14 liter. So if we multiply 3 into 14, we will get 4, 12, 31, 3, 3, 42. Divided by 4, we will get, here will go 1, 1, then 0, 0.5. So 10.5 liter is the interstitial compartment of the extracellular fluids. So the question, they might come in many different ways, but we have to remember that the total body water contains of 2/3 of intracellular fluids and 1/3 extracellular fluids, and these extracellular fluids further divided into intravascular 1/4 and interstitial 3/4 of this extracellular fluid. We just have to remember this, and then we can solve the question if it came in the exam. Question number 3. The water loss in stool is option A 200 ml per day, option B 300 ml per day, option C 400 ml per day, option D 500 ml per day. Correct option here, option A, that is 200 per day is the amount of fluids lost through stools, or what we call is insensible loss. Question number 4. Insensible water loss from the skin and respiratory tract is roughly option A 200 to 300 ml per day, option B 200 to 400 ml per day, option C 400 to 500 ml per day, option D 300 to 500 ml per day. What is this insensible water loss? Insensible water loss is the amount of water loss through which we cannot measure. That is called insensible water loss, and the amount of this insensible water loss through respiratory tract and skin is roughly 400 to 500 per day, and the degree of this insensible loss may vary depending on the respiratory rate, the metabolic state of the body, and the temperature of the body. And this water loss is increased by 100 to 150 ml per day for each degree of body temperature above 37 degrees Celsius. Question number 5. Calculate the cerebral perfusion pressure of a patient having blood pressure of 100 by 7 millimeter of mercury and ICP or intracranial pressure of 14 millimeter of mercury. Option A 60 mmHg, option B 66 millimeter of mercury, option C 64 millimeter of mercury, option D 68 millimeter of mercury. What is this cerebral perfusion pressure? It is a net pressure gradient that drives oxygen delivery to cerebral tissue, and it is the difference between mean arterial pressure and the intracranial pressure, and it is measured in millimeter of mercury. So this CPP is the difference between mean arterial pressure and the intracranial pressure, and it is measured in millimeter of mercury. So here, how to find this CPP? Here we get the value is given, the BP, the blood pressure of 100 by 70, and intracranial pressure. So first of all, we have to calculate the mean arterial pressure or the MAP. And how to calculate the mean arterial pressure? The formula is twice diastolic pressure plus systolic pressure divided by 3. So twice of diastolic 2 into 70 plus systolic is 100 divided by 3. So 2 into 70 we get 140 plus 100 divided by 3. So 140 plus 100 we get 240 divided by 3 we get 80 mmHg or millimeter of mercury. So therefore the CPP is equal to, here is the MAP or the mean arterial pressure 80, and the intracranial pressure is given 40, which is equal to 80 minus 40, we get 66 millimeter of mercury. So the correct option here, option B, 66 millimeter of mercury. Question number 6. A patient received in emergency and his BP is 154 by 94 millimeter of mercury and MAP is 114 millimeter of mercury. Calculate the pulse pressure. Option A 60 millimeter mercury, option B 65 millimeter mercury, option C 64 millimeter mercury, option D 70 millimeter mercury. This pulse pressure is the difference between systolic BP and diastolic BP. So pulse pressure equal to systolic BP minus diastolic BP. So the systolic is 154 minus 94. We will get 64 mm of mercury. So the correct option here is option A, that is 60 millimeter of mercury. Or the question can also come in this way, where they will give you the map of the patient and they might give only the diastolic pressure. So in that case, how? Suppose the patient is received in emergency and the value they will give you only the diastolic BP of 94 and the map of 114 millimeter of mercury. So here how we will calculate this pulse pressure? So the formula for map also, there is two formula for map. One is twice diastolic BP plus systolic BP divided by 3, and this second one is diastolic BP plus pulse pressure by divided by 3. We will also get it, or from here follows map equal to thrice diastolic BP plus pulse pressure divided by 3. So if you have to calculate the pulse pressure using this formula, so we will see the map is, from here follows, the map is 114 and the diastolic is 3 multiplied by 94 plus pulse pressure, which we have to find, divided by 3. So from here it follows this 3 will go this side. So 114 multiplied by 3, we will get 342. So and 3 multiplied by 94, we will get 282 plus pulse pressure. Therefore pulse pressure equal to this 342 minus 282. So the answer will, or we can also say from here follows pulse pressure equal 342 minus 282, which is equal to 60. So the answer came to be the same. So if the in exam, if they give you only the map and the diastolic BP, you can use this formula to calculate the pulse pressure. Question number 7. The difference between the apical and the radial pulse is option A, pulse difference, option B, pulse deficit, option C, pulse pressure, option D, none of the above. The correct option is option B, that is pulse deficit, is when the apical pulse doesn't match, or there is, like the apical pulse may be more and the radial pulse is less, like in the case of atrial fibrillation. So that situation is called a pulse deficit. Question number 8. A patient is admitted in the ward with bedsore of full thickness, tissue loss, visible fats, but bone, tendons or muscles are not exposed. Determine the stage of his bedsore. Option A, stage 1, option B, stage 2, option C, stage 3, option D, stage 4. Stage 1 bedsore is when the skin is intact skin with non-blanchable redness or local redness. And stage 2 is when there is partial loss or partial thickness loss of dermis. And stage 3 when there is full thickness or the tissue loss, full thickness of tissue loss with visible fats. And stage 4 is when there is full thickness of tissue loss, when there is tissue loss with exposed bones exposed bones or tendon or muscles. So the correct option here, option 3, that is option C, that is stage 3. Question number 9. A patient receiving oxygen via nasal prong at the rate of 2 liters per minute. Each additional liter of flow increases FiO2 by option A 2%, option B 3%, option C 4%, option D 5%. The correct option here is option C, that is 4%. In each additional or each liter of oxygen increases FiO2 by 4%. Question number 10. An intubated patient with a ET tube connected to a ventilator in volume control mode. Patient with volume control mode has high risk of having option A, VAP or ventilator associated pneumonia, option B, barotrauma, option C, mortality, option D, all of the above. Here we have to see the statement states here that the patient is on ET tube connected to ventilator and the mode is in volume control mode. So the patient who gets a ventilator setting of volume control mode is high risk of developing barotrauma due to the volume of air that goes inside the patients. Whereas this VAP, it can be happen in any mode of ventilator, and mortality also it can happen in any mode of ventilator.